Big Country Politics on KTAB continues.
All right, and welcome back to Big Country Politics. Dr. Paul Fabrizio, political science professor from McMurray University, joining us here today. Dr. Fabrizio, thank you for joining us today.
It's good to be here at our social distance.
Yeah, we are trying to stay a little bit apart. We actually like each other, but it's all good. Now, there's really not much to talk about. No, I'm just kidding.
What?
Right, coronavirus. It is coronavirus affecting everything we do in our lives. And politically, it is what everyone is doing, right?
Yes.
So the CARES Act recently passed. So the CARES Act is the one that, we're going to be getting $1,200 checks if you make $75,000 or less here pretty soon. What's kind of your analysis of the CARES Act? And it was a bipartisan effort.
Yeah, what's obvious is that both parties realize we're in an unusual place and they have to take quick action. And so they did. They passed $2.2 trillion of aid to Americans. And as soon as that's done, they started working on a new plan. And there's talk about that would be phase 4. Then they're talking about phase 5 in terms of help for Americans. On top of that, on Thursday, the Fed issued more help for American businesses. It's making more loans available. The government at the national level, both parties realize this is the equivalent of the Great Depression, and we need to take action to prevent the Great Depression in this century from happening.
Wow.
So they're trying anything they can.
Talking about the Great Depression again.
Yeah, that's a really frightening thing to say, but that is the fear. And the longer we're in this downturn, where basically we have to keep our social distance, where American business can't operate, the greater the likelihood that the economy will be in for a very, very rough patch. We're probably in a recession right now. They're talking about possibly 10% of the country is out of work, and that number is only going to go higher. So the longer this lasts, the harder it will be to dig out in a quick manner.
So obviously, that's the reason that everyone is preaching social distancing, because the further we stay away from people now, the quicker it'll be, right? Hopefully.
See, this is a weird thing. What we have in our country right now is the public health people saying we need to social distance ourselves. And then we have basically the people who are concerned about the economy, economic welfare, who are saying we need to get this over as much as possible. But the more we social distance ourselves to flatten the curve, what that does is it spreads out the illness for a longer period of time. So instead of having a peak, like what New York is experiencing with tremendous death and overrunning the hospitals, instead we're going to, if we flatten the curve, we're going to have a more gentler but longer cycle, which means we could potentially be in this social distancing for a longer period of time, which would delay getting back to normal economic activity. So that's why the public health people are arguing with the business people.
Right. So when that is an interesting way of putting it, and so it makes sense. So flattening the curve, we're actually elongating it, but lessening the impact right now on the medical facilities, right?
Right. Not just medical facilities. It's all of us in terms of when will we get it. The reality is you listen to some of the people. They're saying that we could see 60% of the American population getting this disease at some point. Do we all want it at once, or do we want it spread over a longer period of time?
And Dr. Fauci says this could be a seasonal thing now.
It could be a seasonal thing. You listen to what the White House is saying. They're talking about this taking place now, and then maybe there'll be a gradual easing up, and then they're talking about, well, maybe November, December, we might have to go back to this, and then maybe next year, all until we have a vaccine. And who knows when that vaccine is coming.
All right, and about the state level, the governor holding regular briefings with Nim Kidd, Dr. Hellerstadt, lots of these names who are becoming almost household names,
Yes.
These officials. So what is the state doing?
In the end, the state has the ultimate responsibility. You know, our focus is always on the national government, but the reality is it's the state that's making the decisions to shut down things. It's the state that's saying we're going to delay elections. It's the state that really is trying to get the resources to the local areas. Our orientation is always towards Washington. But in the end, in matters of public health, it's really the state that matters. So when we look at what's going on, our attention really should be on what the governor is saying, what the state medical director, what they're doing, because they're really at, I'm not sure the front lines is the right way to describe it, but they're the deciders. You notice that the federal government gives guidelines, it gives advisories, the governor gives orders. The governor says, we're shutting down.
Well, that's kind of like the 10th Amendment, right?
Yes, it's all about the 10th Amendment. This is federalism in action. And so we have it's disorganized, and you know, we can argue at some point whether it's a good system or not, but this is our system where the states are the ones who are responsible for our public health. And the federal government does what it can, but in the end, it's the state that really has to say, okay, this is what we're going to do, this is where you can go, this is what we're going to enforce, this is not what we're going to enforce.
All right, and when we come back, even more direct, local government and what their response is about COVID-19. We'll be back in 2 minutes.